Well, obviously this is a time of great change in the healthcare industry, which means both challenges and opportunities, but the Nashville healthcare community is really poised, I think, to take advantage of those. The good news is that millions of people will be getting health insurance coverage. So there will be more people getting access to healthcare, but the healthcare industry is going to need to innovate and think about how to meet the needs of those new customers and do so in a way that's financially sustainable for state and federal budgets. So the question is, how do you bring value to the healthcare system and improve health outcomes? And I think that's a great challenge and opportunity for the Nashville healthcare community. It's an exciting time to be in healthcare.
You know, it's been fascinating to watch the beginning of the exchange open enrollment season and see market to market the variability in competition. Some markets have intense competition, new entrants, Medicaid plans going on to the exchange, integrated health systems that become insurers and going on the exchange. And then you have 55% of the counties of the United States of America that only have one or two competitors in the exchange market. So there's a broad spectrum of competition. It's early in the game, broad price variability as well. It's a grand experiment.
Hospitals will play a critical role in exchange enrollment and the implementation of the new health reform. At the end of the day, hospitals want to care for patients and, to the extent possible, want to remove the financial questions for the patient and just focus on getting patients well. And that's why the implementation of health reform and the opportunities that are offered by the new possibilities for coverage are so important. Hospitals, to the extent they can, are going to help those who don't have insurance obtain insurance through the new means that are available in the exchanges.
Well, it's critical to have younger individuals sign up for health care to ensure a balanced risk pool. If we only have older Americans sign up, older Americans tend to have a higher cost of care, and that'll increase premiums for everyone else. So having the younger, healthier sign up, they have lower cost of care, that balances the risk pool and helps bring down premiums, so the cost of coverage is more affordable for everyone. So it's critical that we reach out to young Americans to let them know it's important to have health insurance and encourage them to sign up.
Well, Nashville has a lot of unique healthcare interests, and I think that particularly our city will be exposed to a completely different marketplace. And what's going to be important for healthcare companies going forward is to look at the way they contract and who they contract with and what kind of third-party payers they want to continue to work with, because we have already seen consolidation of health plans in terms of their networks and trying to distinguish themselves from the rest of the market with the quality of their networks. And I think that's going to make contracting a much more important feature for our healthcare companies in Nashville.